Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, CPT codes and how they are used. Current procedural terminology. CPT codes help healthcare providers track and report medical services and procedures. The specific CPT codes attached to each service or procedure help maintain accuracy and efficiency in medical billing and reporting. /R/N/R/N insurers use CPT codes to determine how much money to pay providers. The same CPT codes are used by all providers and payers to make the billing process consistent and to help reduce errors. /R/N/R/N Courtney Hale, Getty Images /R/N/R/N A CPT code is a number used to identify a medical service or procedure. CPT codes are used by healthcare providers for reporting, billing, and administration purposes. /R/N/R/N Some CPT codes are only used occasionally, and some are not really used at all. Other CPT codes are used frequently. For example, 99213 and 99214 are codes for general office visits, usually to address one or more new concerns or complaints, or to follow up on one or more problems from a previous visit. /R/N/R/N The American Medical Association, AMA, develops, maintains, and has copyrighted the CPT codes that are currently used in over 60 countries. These codes can change as healthcare changes, and new codes can be made and assigned to new services. /R/N/R/N Current CPT codes can also be revised and unused codes thrown out. Thousands of CPT codes are used and updated every year. /R/N/R/N CPT codes are 5 digits. Most consist of only numbers, but some have numbers and letters. There are several categories of CPT codes. /R/N/R/N Bundled services are a single CPT code that describes several services that are performed together. /R/N/R/N For example, if you break your arm and get an X-ray and a cast, these services might be bundled under one code for billing. /R/N/R/N Here are some examples of CPT codes. /R/N/R/N Some of the most frequently used CPT codes are :/R/N/R/N Very well, Laura Porter /R/N/R/N CPT codes directly affect how much a patient will pay for the medical care they receive. /R/N/R/N Provider offices, hospitals, and other medical facilities are strict about how CPT coding is done. They hire professional medical coders or coding services to make sure that services are coded correctly. /R/N/R/N CPT codes have different uses than ICD codes. CPT codes identify the services provided to a patient, and ICD codes identify diagnoses. The CPT code system is managed by the American Medical Association, while the ICD code system is managed by the World Health Organization. /R/N/R/N You'll see CPT codes in many different documents that you'll get as you move through the healthcare system. /R/N/R/N The 6 sections of CPT codes are evaluation and management, anesthesia, surgery, radiology, pathology, and laboratory, and medicine. Each of the 6 sections also has sections within it that offer more detail about, say, this is ./R/N/R/N If you're looking at your healthcare providers and insurance billing process, you might want to know what all the codes mean. /R/N/R/N However, CPT codes are copyrighted by the AMA and they charge a fee to use them. That means that you will not find a full list of CPT codes with explanations online for free. /R/N/R/N That said, the AMA does provide consumers with a way to look up the CPT codes. Here's how to find out what a CPT code means. /R/N/R/N You can use the same steps to look up bundled codes. /r/n/r/n. Understanding CPT codes can help you make sure that your hospital bill is correct and catch any insurance billing errors which do happen often. Some patient advocacy groups say that nearly 80% of bills for medical care contain minor errors. /r/n/r/n. These simple mistakes can have a big impact on your wallet. In fact, the wrong CPT code can mean that your insurance will not cover any of the costs. /r/n/r/n. Always review your bill carefully and compare it with your EOB to check for mistakes. It's not uncommon for healthcare providers or facilities to code for the wrong type of visit or service, typographical errors. /r/n/r/n. There are also fraudulent practices like upcoding, which is when you are charged for a more expensive service than the one you got. On the other hand, unbundling is when bundled services or procedures are billed as separate charges. /r/n/r/n. If you come across something in your medical bill that doesn't add up, call your provider's office. It could be a simple mistake that the billing department can fix. /r/n/r/n. While they are meant to help make the billing process in healthcare more uniform, the existence of CPT codes does not mean that everyone defines a healthcare service the same way. /r/n/r/n. CPT codes also do not ensure that different healthcare providers will get paid the same amount for the same service because payment is outlined in the contracts between providers and insurers. /r/n/r/n. For example, healthcare provider A may perform a physical checkup, $99,396, and be paid $100 by your insurance company. However, if you went to healthcare provider B, the payment for that same CPT code might only be $90. /r/n/r/n. CPT are not the same as the Healthcare Common Procedure Coding System, HCPCS, but they are similar. If you use Medicare, you'll see HCPCS codes in your paperwork instead of CPT codes. /r/n/r/n. HCPCS codes are used and maintained by the Centers for Medicare and Medicaid Services, CMS. They are used to bill Medicare, Medicaid, and many other third-party payers. /r/n/r/n. HCPCS Level 2 codes start with a letter and have 4 numbers. They may also have extra modifiers, either 2 letters or a letter and a number. Examples of items billed with Level 2 codes are medical equipment, supplies, and ambulance services. /r/n/r/n. HCPCS Level 2 code lists can be found on the CMS website. Level I codes, however, are copyrighted by the AMA just like CPT codes. /r/n/r/n. CPT codes are combinations of letters and numbers that match up with healthcare services and supplies. The AMA developed CPT codes to make sure that all healthcare providers have a uniform system for reporting the services they give to patients. /r/n/r/n. When you visit a healthcare facility, your provider uses CPT codes to let your insurer or payer know which services you got from them. The insurer or payer then reimburses the provider based on the CPT codes. You can see the codes on your discharge paperwork, bills, and benefit statements. /r/n/r/n. It's a good idea to check the codes when you receive a bill or statement. Your provider or the coder can sometimes make mistakes. Correcting medical record errors can help ensure you aren't paying more than you should. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.